Your legs and feet might be sending out crucial warnings about your heart that you're entirely overlooking. Currently, over 6 million Americans are grappling with congestive heart failure, yet many remain unaware that their swollen ankles or consistently cold feet are actually urgent distress signals from a heart that's struggling. Here's the critical truth. Heart failure doesn't always manifest with unmistakable chest pain. Instead, it often communicates through subtle symptoms that most people dismiss as typical signs of aging, being overweight, or simply standing for too long. That persistent ankle swelling you attribute to ill-fitting shoes, or the numbness in your feet you blame on prolonged sitting, these could be your heart's final attempts to capture your attention before it's too late. Welcome to our channel. If you're new here, we're delighted to have you join our community, which is dedicated to transforming health through knowledge. Be sure to hit that subscribe button and activate the notification bell so you never miss life-changing content like this. We love connecting with our global audience, so please leave a comment letting us know which country you're tuning in from. Your journey toward better health truly begins with understanding these vital warning signs. Today, we're unveiling 12 scientifically proven symptoms that specifically manifest in your legs and feet when heart failure begins to set in. These are not random inconveniences, they are your body's emergency alert system. Medical research has definitively linked each of these symptoms to the progressive decline of your heart's pumping capability. Recognizing them early could genuinely make the difference between life and death. Now let's delve into the warning signs of congestive heart failure, starting with number one, cold feet. Most people tend to brush off cold feet as merely poor circulation or a need for warmer socks. However, when your heart starts to fail, it's confronted with an impossible decision: where to direct the limited amount of blood it can effectively pump. Your body's inherent survival instinct takes over, prioritizing blood flow to your most vital organs: your brain, heart, lungs, and kidneys. This means that your extremities, especially your feet, are relegated to the very bottom of the priority list. Research published in Circulation has extensively documented this phenomenon. The study revealed that patients with reduced cardiac output consistently reported cold extremities as one of their most noticeable symptoms. What's particularly striking is that this coldness often affects the feet more profoundly than the hands, primarily because the feet are furthest from the heart and require the most effort to maintain adequate circulation. Unlike normal cold feet that typically warm up with movement, cold feet related to heart failure remain consistently cool regardless of external factors. Patients often describe their feet feeling ice cold even when wearing warm socks and shoes, or when the rest of their body feels comfortable. Next, symptom two, pitting edema. If you've observed swelling in your legs or ankles, try this simple test that medical professionals often use. Press your finger firmly into the swollen area for approximately 10 seconds, then release. If you notice a deep indentation or pit that remains for several seconds, you're looking at pitting edema, and this alters everything. Pitting edema isn't merely ordinary swelling, it's a specific type of fluid accumulation that conveys a very particular story about what's occurring inside your body. Research published in the American Heart Journal has established a direct link between pitting edema and right-sided heart failure. When the right side of your heart begins to fail, it loses its ability to efficiently pump blood, returning from your body back to your lungs for oxygenation. This creates a backup system where blood pools in your venous system, and the increased pressure forces fluid out of your blood vessels and into your tissues. The indentation you observe is literally the displacement of accumulated fluid, and the fact that it doesn't immediately spring back to its normal shape reveals just how saturated your tissues have become. Next, symptom three, muscle weakness in legs. Recent groundbreaking research published in Circulation, Heart Failure, has revealed that patients with chronic heart failure frequently experience skeletal muscle weakness that severely limits physical function. This isn't just about feeling tired, it's a fundamental alteration in your muscle's ability to contract and perform. When your heart can't pump blood effectively, your leg muscles don't receive adequate oxygen and nutrients. The research shows that heart failure patients exhibit reduced myosin heavy chain protein content in single muscle fibers, which manifests as a reduction in functional muscle contractions. This selective loss of muscle protein specifically impairs your ability to climb stairs, walk distances, or perform activities requiring leg strength. The study found that patients with more severe heart failure had the weakest leg muscles and experienced greater muscle weakness after minimal exertion. This muscle weakness persists even when cardiac function is improved through treatment, indicating permanent changes to the muscle structure. Next, symptom 4, weight gain from fluid retention in the lower body. You step onto your scale and discover you've gained several pounds seemingly overnight, or perhaps 5 to 10 pounds over just a few days. When this weight gain is accompanied by swelling in your legs and feet, you're not looking at fat accumulation, you're witnessing your body's desperate attempt to cope with a failing heart. The Mayo Clinic proceedings identified rapid weight gain from fluid retention as a key red flag that demands immediate medical attention. This isn't just about numbers on a scale. This weight gain represents a fundamental breakdown in your body's ability to maintain proper fluid balance. Unlike gradual weight gain from increased food intake, fluid retention can cause dramatic weight increases in remarkably short periods. Some patients report gaining 10 to 15 pounds in a single week, all from retained fluid. The weight tends to concentrate in your lower body due to gravity, making your pants feel tight around the calves and your shoes no longer fit properly. Next, symptom 5, dusky or blue legs. When you glance down at your legs and notice they've taken on an unsettling bluish or dusky appearance, this indicates cyanosis, one of the most visually striking and medically significant signs that your heart is struggling to maintain adequate circulation throughout your body. Research published in ESC Heart Failure documented cyanosis as a critical peripheral manifestation of congestive heart failure. Cyanosis occurs when oxygen-poor blood begins to dominate your circulation, particularly in areas where blood tends to pool or move more slowly. The bluish tint first appears in the most dependent parts of your body, your lower legs, ankles, and feet. As heart failure progresses, this discoloration becomes more pronounced and persistent. The bluish tint may spread from your toes and feet up your lower legs, and it often becomes more noticeable when you're sitting or standing for extended periods. This color change reveals the desperate state of your circulation and the profound impact on tissue oxygenation. Next, symptom 6, swollen ankles. Swollen ankles represent one of the most visible and earliest warning signs of congestive heart failure. When your heart begins to weaken, it cannot pump blood efficiently throughout your circulatory system. This creates increased pressure in your veins as blood backs up from the weakened heart. Research published in JCC Heart Failure confirmed that ankle swelling is not only one of the most commonly reported early signs of heart failure, but it's also one of the most reliable predictors of the condition's progression. As this backed up blood creates increased pressure in your veins, fluid begins to leak out of your blood vessels and into the surrounding tissues. Your ankles become the primary collection point for this excess fluid because gravity naturally pulls it downward. What makes this symptom particularly concerning is how it typically doesn't subside with rest or elevation. It persists, gradually worsens, and often becomes more noticeable as the day progresses. Next, symptom 7, slow healing sores on legs or feet. When you develop a small cut, scrape, or sore on your leg or foot that should normally heal within days, but instead lingers week after week, this reveals a critical problem with circulation and oxygen delivery that stems from your failing heart. The Journal of the American Medical Association published research highlighting the connection between impaired wound healing and congestive heart failure. The study demonstrated that heart failure patients experience significantly delayed wound healing due to tissue hypoxia, reduced immune function, and compromised circulation. When your heart can't pump blood effectively, your tissues suffer from chronic oxygen deprivation. Wound healing is an incredibly oxygen-demanding process that requires robust blood flow to deliver nutrients, immune cells, and building materials to the injury site. When heart failure compromises this blood flow, even minor wounds become major problems that may take months to close, and some may never heal completely. Next, symptom 8, leg cramps or pain while walking. After just a few minutes of walking, your leg muscles begin to cramp and ache with an intensity that forces you to stop and rest. This symptom, known as claudication, represents one of the most functionally limiting symptoms of congestive heart failure. The Journal of Cardiac Failure published research demonstrating the direct link between claudication symptoms and reduced cardiac output in heart failure patients. When your heart begins to fail, it cannot pump blood efficiently enough to meet your body's demands during physical activity. Your leg muscles, being some of the largest and most active muscles in your body, quickly feel the effects of this reduced blood flow and oxygen delivery. As heart function declines, patients consistently report experiencing muscle pain, cramping, and fatigue in their legs during activities that were previously effortless. Initially, you might only notice muscle fatigue during strenuous activities, but as heart failure progresses, these symptoms begin to occur with increasingly mild activities. Next, symptom 9, restless legs. At night, you settle into bed hoping for rest, but your legs begin to feel like they have a mind of their own, twitching, cramping, and filled with an indescribable urge to move. Research published in Sleep Medicine Reviews revealed the connection between fluid redistribution and the development of restless leg symptoms in heart failure patients. During the day, as you stand and walk, fluid from your compromised circulation tends to accumulate in your lower legs and feet due to gravity. When you finally lie down at night, this accumulated fluid begins to shift and redistribute throughout your body. As the excess fluid moves from your legs back toward your core circulation, it can compress nerves, alter electrolyte balances, and create sensations that your brain interprets as an urgent need to move your legs. This nighttime fluid shift creates nerve compression, leading to tingling, burning, or crawling sensations. The compromised circulation associated with heart failure means that your leg tissues may already be struggling with adequate oxygen delivery, and the nighttime fluid shift can exacerbate this problem. Next, symptom 10, worsening varicose veins. When existing varicose veins suddenly worsen or new ones appear rapidly, your body might be revealing a much more serious underlying problem. Research published in the Vascular Medicine Journal revealed a significant connection between heart failure and the rapid progression of varicose veins. Varicose veins develop when the one-way valves in your leg veins become weakened or damaged, allowing blood to flow backward and pool in your lower extremities. When congestive heart failure enters the picture, this already compromised system faces an additional overwhelming challenge. When your heart begins to fail, it creates increased pressure throughout your venous system as blood backs up from the weakened heart. This elevated pressure puts enormous stress on your leg veins and their already compromised valves, causing them to fail more rapidly and completely. Patients with previously mild varicose veins often report that their condition deteriorates dramatically over just a few months when heart failure develops. Next, symptom 11, skin changes. When you examine the skin on your lower legs and feet, does it appear unusually shiny, almost as if it's been stretched tight? Does it feel different to the touch, perhaps thinner, more fragile, or strangely smooth? These are profound changes that reveal how fluid retention from heart failure is literally transforming your skin. Research published in Heart and Lung documented these characteristic skin changes extensively in chronic heart failure patients. When congestive heart failure causes fluid to accumulate in your tissues, it doesn't just create swelling, it fundamentally alters the structure and appearance of your skin. The excess fluid stretches your skin beyond its normal capacity. The shininess you might observe occurs because normal skin has a matte appearance due to its natural texture. But when fluid accumulation stretches the skin taut, it flattens these natural features, creating a smooth, shiny surface that reflects light differently. This change is so characteristic that healthcare providers often use it as a visual diagnostic clue for fluid retention. Next, symptom 12, numbness or tingling in the feet. The unsettling sensation of your feet falling asleep becomes a constant companion throughout your day. Research published in current heart failure reports revealed the significant prevalence of these neurological symptoms in heart failure patients. Numbness and tingling in the feet related to congestive heart failure can occur through two primary mechanisms. The first involves direct nerve compression from tissue swelling. As fluid accumulates in your feet and lower legs due to poor heart function, this swelling can compress the small nerves that provide sensation to your feet, creating numbness, tingling, or even shooting pains. The second mechanism involves reduced oxygen supply to the nerves themselves. Your peripheral nerves require adequate oxygen to function properly. When heart failure reduces blood flow to your extremities, the nerves in your feet may not receive enough oxygen to maintain normal function. This oxygen deprivation can cause the nerves to misfire, sending false signals to your brain that you interpret as numbness or tingling. Initially, you might experience mild tingling that comes and goes, but as heart failure progresses, these sensations can become constant and more intense. Some patients report feeling like they're walking on pins and needles, while others describe their feet as feeling completely numb. As we've explored these 12 critical symptoms, one thing becomes crystal clear. Your legs and feet are sophisticated early warning systems that can detect heart failure before it becomes life-threatening. Every symptom we've discussed represents your body's desperate attempt to communicate that your heart needs immediate attention. The research is unambiguous. These symptoms aren't minor inconveniences to be dismissed. They're evidence-based indicators of a condition that affects millions and continues to claim more lives than many forms of cancer combined. However, recognizing these symptoms early can be the crucial difference between a manageable condition and a medical emergency. Remember, congestive heart failure doesn't always announce itself with dramatic chest pains. More often, it whispers its presence through the subtle changes we've explored today. That persistent swelling that doesn't go away with rest, the cold feet that no amount of warm socks can fix, the mysterious weight gain that seems to appear overnight. These are all your body's ways of asking for help. If you recognize multiple symptoms from today's discussion, don't wait for them to worsen or hope they'll resolve on their own. Contact your healthcare provider immediately. Early intervention in heart failure can dramatically improve outcomes, quality of life, and longevity. If this video was helpful in opening your eyes to these critical warning signs, please kindly type "helpful" in the comments. That truly motivates us to continue producing life-saving content like this. Please hit that like button if you found this information valuable, share it with anyone who needs to see this, and don't forget to subscribe for more health insights that could change your life. Thank you for taking the time to learn about these crucial symptoms. And remember, recognizing these signs early could be the most important thing you do for your future.